Okay, well, I will talk about complications, something that you need to maybe keep in mind when you treat your patient over the robotic area. Not have any conflict of interest. What is siderosis? Siderosis is a disease characterized by the accumulation of iron in various tissues. Browny gray discoloration of the skin can be seen as a side effect of the injection area after the parenteral iron treatment. And the classical way to introduce that is intravenous muscular injector iron, and of course, take in mind post-trauma or post-surgical hematoma. I made my research, you use these two words, skin siderosis, you find 36 results in the PubMed. But if you look for gluteal siderosis, it's only 2 cases, only 2 reports. That's why it's something really new or there's no solution. Let me see and show you if we found any kind of solution. The first report was a report, localized cutaneous siderosis following intramuscular iron injection. They give you, they describe the problem, but don't give any kind of solution. And the last report, this is really important because it was last year. He made the research of 7 articles in PubMed and Cochrane, a total of 54 patients, all female. 84% of them are because IAB iron infusion, and only they found clearance in 54% of them. I take an account this particular article for rolling because there are many patients in the gluteal area. 5 patients, 4 in gluteal area, only 1 in forearm. And they used Q-switch laser, Ruby, and laser. Many times of session looked at the way they 3 to 16, but they all found, and all patients said marker clearance. That's what here is the solution. The only way is with Q-switch laser, pico laser or nano laser. If you have pico, it's better than that because pico, as you know, you have a pure photomechanical effect, not have any kind of thermal effect, and by this you can obtain a more disruption of the particle. By this, our macrophages can eat it well, faster and easier. How does this work? By this, imagine that this phantom is the particle ink is bigger than the mouth of our Pac-Man. That's why we need to help him. We apply the laser. After that, we create little phantoms, little particles, and make it easier the work of macrophages to eat it well and thrown away by the lymphatic system, and finally you went to thrown away by the urine. This is my experience from July 2015 to July 2024. With gluteal siderosis, I treated 22 patients, all female, between 70 to 51 years old. The average is 24. Majority of them are bilateral, but I have 6 cases of unilateral. And again, look the rate of session, 2 to 15. The average is 6. Yeah, and there's a satisfaction level survey. This was created by Rowling, and I copied this satisfaction level survey. They rated that 4 completed clearance, 3 market clearance, 2 moderate clearance, 1 nearly no clearance, and 0 no clearance at all. And here is my result. Over the patient that I can again obtain the survey completed, 72% of my patients, I found 12 in the rating that 2 to 4, is a good weight I clearance these patients. 6 patients didn't answer because I don't find it many years ago, or they don't want to answer the survey. That means that 70% of the patient answers as moderated to complete erase of the siderosis by the treatment of pico laser. That's why this is the gold standard, nano or pico, for this kind of lesions. 18% of the patient answered that no clearance of siderosis, but the patient that rated 0, they go away for the treatment. They reject the treatment. Only 4 sessions is not good enough. That's why maybe if I had the possibility to make more sessions, the patients are really happy with me, really happy with the treatment, and rated better. This is all my data of my patients. And where is the mechanism of action? Because the first fact is the iron injection are frequently performed by intramuscularly using a 40 millimeter long needle. It's a long needle. It's inside the muscle, not on the skin. Okay? This is the first fact. But the second fact is the Q-switch laser only can act in the thick of the skin. There's something weird here. The laser only can reach 7 millimeters, and I put the needle in 40 millimeters. What happened here? Well, again, talking about Rowling, he found many numbers of heavily pigmented leading macrophages appear in all dermis layers. Okay? These pigmented are inside the macrophages in all the layers of the skin. What happened here? Here is my hypothesis. The macrophages inside all the body, inside the muscle too, are taking this particle of ink, raise it to the surface, and that's why I can apply my laser and I can be successful, because it's close to the skin, not in the inner part of the muscle, because it's impossible to any kind of laser act inside the muscle. This is the only case that I have a post-trauma. It's a patient that applied many hyaluronic acid in the buttock. After that, he rejected the result and asked for hyaluronidase. It was made for another colleague, not for mine, for me. The colleague sent me the problem to me because the patient appeared with this hyperpigmentation, 5 years of evolution, and the patient are completely angry with my colleague and with me. That's why she rated as only 1, and she only performed 2 or 3 sessions. But be careful when you apply a lot of injection or you make a subcision in the area, because in some cases the siderosis can appear. This is the treatment. This is the way I apply the Q-switch laser. I'm looking for this parameter that the people who have the Q-switch laser, I start with the biggest size of spot, 10 millimeters, with the less energy, only 1 joule, and session per session, I reduce the size and increase the energy, okay? And this is my goal. This is my gold standard. This is my endpoint. I look for erythema, mild frosting, and mild swelling. If I'm not obtaining that, I didn't stop the treatment. Well, take a look to my result. I talk a lot, but you didn't saw my result. And here is amazing, because I follow the patient not after a month, not after a year, after 4 years. And here is the result. A complete disappear of this pigmental lesion. Here, in the up part of the slide, you always see my parameters and the level survey rate of the patient. He's put it 4 as completed clearance. This is the other side of the same patient. Again, before, after 5 months, after a year, and after 4 years, complete removal of these pigmental lesions. One of the biggest, better cases, look at no answer. The patient don't answer the survey. If for sure you have the possibility to contaminate patient, the patient need to rate it at 4, because it's completely erased of all these pigmental lesions. And looked up, 13 sessions was needed to obtain this kind of result. Again, 13 sessions to obtain this result in the same patient that don't answer the survey, but for sure need to rate it at 4. Another case, she completed the survey, she give me a 4 as the level of satisfaction, and only 5 sessions. This is weird. I usually take more sessions to have this kind of result. Another case, marked at 3, marked clearance, the result after 9 sessions. More cases, 5 sessions, the patient don't answer, but again, I obtain at least a reduction of the hyperpigmentation in this area. All this data give me the possibility to write this chapter in the book. This is a QR. You can free download all the chapter of the book. And finally, if be on time, my take-home message. Gluteal siderosis is more frequently injury than previously thought. Many people, many of you, unfortunately, when you have anemia, the medical doctor requests for injection in the buttock. Well, unfortunately, many of you in the future can avoid with, or need to afford this problem. Any application of intramuscular iron or trauma carries the potential risk of gluteal siderosis. Taking into account the diagnosis and treatment in surgical and non-surgical procedure of the buttock, as I mentioned, the majority is for iron injection, but some cases, as I show you, is for trauma, for injection of hyaluronic acid, for injection of hyaluronidas, or any kind of subcision or procedure that you perform in the buttock. The only treatment that was demonstrated was efficacy and good result as the Q-switch laser, as I show you. In general, more sensation, more clearance, and more satisfaction rate. Try to don't be on rush and say to the patient, this is a patient for a complete year, not for a month, for a complete year. And given a choice, as you have the picosecond laser, has proven more effective than the nanosecond laser. I have more experience in tattoo removal, but I have the same experience in these cases of siderosis, gluteal siderosis. I invite all of you to this Congress, since melasma, in the city of Bogota between August 15 and 17. We'll talk about any kind of pigmental lesion, for example, gluteal siderosis. Thanks so much.